This government meeting is brought to you by Eastworks and our local cable subscribers.
Okay, good afternoon. Today is December 7th, 2022. This is a Southampton Council on Aging and Multitasking at Aging Board meeting. The meeting is being recorded via Zoom. So we will do all roll call counts verbally. So, okay. So it's 4:03 for the meeting being called to order from our clerk, our minute taker. Hi, Josie.
Hello. How's everyone?
Good. Welcome. So we will start with the approval of the minutes. Did anybody want to make a motion and we can have discussion, or?
I'd move to accept the minutes.
And
I'll second it.
I have a second. Any discussion at this point? Rini.
I just wanted to mention, let me just bring them up. If you look under the part where it says senior property tax work-off program, it says Joan reported on recommendations to improve this program for helping qualifying seniors reduce their property tax. A major improvement would be to increase the hourly amount that participants are credited with for their volunteer work. Can I just add that?
Rini, where's the paragraph? I'm just trying to bring it up here.
It's all the way right before you hit old and new business.
Paragraph before that.
Thank you. Go ahead, Rini. Sorry.
Yeah, that's okay. I just wanted to just mention that it's the discussion centers around the minimum wage in the state of Massachusetts is going up to $15 an hour in January. So the reason for the increase in the hourly amount that participants are credited for is to compensate them for the discussion. And I don't think there's a vote by anybody yet on this. But the idea is that it's to compensate people at the minimum wage equivalent at $15 an hour. So they won't get $15 an hour, but that would mean that they would end up working less hours because they'll get more hourly equivalent. So I just wanted to be clear about what that was about.
So, Rini, so we could just add something. I'd have to make sure I get the grammar, but essentially to say so as to compensate at the new state minimum wage equivalent.
Yeah, starting in January 2023.
But call it minimum wage equivalent?
Yeah.
Okay.
Since it will change, I don't know if it's going to go up after next year or not, but
there was a change in January of 2022.
But Joan, that wasn't part of the discussion of the meeting, correct?
Okay. Well, okay. I just wanted to say there was 14 1/4, and that was approved.
Okay.
Right, but I don't think the work equivalent for the tax work-off program has changed at all with these minimum wage increases, but it was proposed that we look at that now so that the people don't have to work at $13 an hour at the equivalent. So they're at least getting compensated. Like, let's say they get $1,000 tax exemption, then the number of hours they would work would be based on $15 an hour. So they would actually end up working less hours than if they were getting compensated at 13 something an hour.
Correct.
Yeah, and it is a $1,500 maximum.
Right. And the deadline was December 1st. So that those have already been given to the assessor.
Yeah, they were just approved on the meeting yesterday, actually, Tuesday. So anyway, I just wanted that statement in there to reflect that it was because of the minimum wage adjustment that's planned for January. I don't think there's been a vote on it yet. It was discussed by the select board. I'm not sure if any other boards talked about it, but that's I just wanted that sentence to be connected to the reason for it is because of the minimum wage adjustment.
Yeah, I'll make that change.
All right, thank you.
So can we have a motion to accept the minutes as amended?
So moved.
Okay, we have to modify, I guess, retract the other one, make them as amended. Do we have a second?
I'll second.
Okay, that's Susan. All right, roll call vote. Jim?
Yes.
Jonathan?
Yes.
Josie?
Yes.
Sylvia?
Yes.
Susan? I'm jumping
Yes.
around here. Did I miss anybody? Sorry. I usually write the names down. And Janet, yes. Okay. Thank you. Thanks for the input, Rini, the clarification. All right. So we have our guest speaker today. There's been a lot of discussion with using some of the ARPA funds we receive from the state for the Council on Aging to investigate the role of an outreach / social worker. Liz, maybe you can give a little bit of your background. I know your scope is greater than 60 and over, but maybe talk about your new position and your background as well. And everybody know Elizabeth Pluff. She is a resident of Southampton, a member of the Fletcher family, and a former member of the COA board. So welcome.
Thanks, Janet. What an intro. That was great. So I am the community social worker for Easthampton. It was a position that opened up in July. So I have been here for the last few months. I came to Easthampton from a medical social work background. So prior to being here, I worked for Bay State at the main hospital campus for a number of years. So I am the community social worker. I am physically housed at City Hall. We do have 2 outreach workers at the Easthampton COA. So I work closely with them, but we have a little bit of separation there. So I have all ages in Easthampton, but I do a fair amount of work with seniors and families who are referring seniors. So in a very, simplified way. So in order for someone to be referred to me, people can self-refer, people can be referred by family members, friends, other organizations. I work closely with all of the area hospitals. If someone is returning home and they feel like there might be some benefit to having some follow-up there. I have seniors who refer other seniors. So it kind of happens in a number of different ways. I spend a fair amount of my time doing home visits. So I am out in the community more than I am in my office. And one of the things that had come up when I started, a previous outreach worker at the senior center had expressed that some people have concerns about going out into the community and going into people's homes and being on their own. So I know that for our senior center, most of their work is done on site, whereas I am going to people and doing what makes things a little bit easier for them. I have covered a variety of topics for seniors. I've had people who are, seniors taking care of spouses, seniors taking care of grandkids, seniors who are facing housing concerns, safety issues at home, safety issues in relationships, medical concerns, health insurance gaps, financial needs. It's sort of been a mixed bag from since I started. We have a couple. There's a couple things in Easthampton that may not necessarily apply to Southampton, but some of our, like the housing programs and some of the apartment complexes, some of the landlords now know me, so they'll call me if they're worried about someone in the building. I've had some cases specific to seniors where people are worried about excessive clutter and maybe some safety in that regard at home. So it's a little bit of everything. I don't know if that's too much or not enough information for you.
I think it's good that you go to the homes, obviously, because you get a true assessment. That you don't get, if somebody comes into your office, you don't really get a true picture of what is happening at home. So,
well, and I think for a lot of people, I'm sure as all of you have encountered, some people are just so fried from constantly being offered the option of like meeting by phone or on Zoom, and they just really want somebody to sit down and help them do the paperwork or have a conversation. And some people have said, they prefer it to come to me or to do it differently just because of COVID concerns. It's very much people's level of comfort, but there have been cases where someone has called me and we've done a fair amount of work over the phone. And then I go out to the home and I'm like, oh, this is very different than what we were talking about. So it does, you're absolutely right. It gives a very different perspective when you can sit down with people in their own environment and see what's going on. Oh, you're muted.
All right. Thanks.
How do you find who do you need to visit? I mean, how do people reach out to you? Are you proactive in some ways to reach out to them, or what's?
Yeah, so I do a fair amount with police and fire. If they go out for an emergency call or something happens, at night or on a weekend, and there's a senior either in the home or involved and they think they might benefit, more often than not, they'll ask, would you be comfortable with some follow-up? We've had some situations where, spouses are in a home together and there's a medical emergency for one of the spouses. And then the next day I will follow up and just make sure that, everything is okay. I have had people can kind of refer all over. So people find me or kind of put something on my radar and I follow up accordingly based on what the needs are. I get some requests through the senior center. So like one of the things that came up right when I first started was a number of seniors were looking for a grief and bereavement group at the senior center. And they did not have, the staff that were there did not feel that they were comfortable to run that group. So I started one there. So even though I don't work at the senior center, I do run a group for them now once a month. We have a preset schedule and I have a couple people who have routinely been attending that. We had some other seniors who said they felt like that there was so much happening in Easthampton for younger people and nothing happening for the seniors. So we had like a little social night for people who felt comfortable to come out and just did some food from one of the area restaurants. And we invited some representatives from police and fire and different organizations in case people had stuff they wanted to talk about. And the mayor came. So I have a fair amount of overlap with the senior center team, but in terms of their outreach coordinators right now, I'm sure, as Joan, you of course know, fuel assistance is huge right now. A lot of cold weather concerns. So their team is really busy with that. So I have tried to address the stuff that is separate from that, that might be helpful for people. And out of the group of us, they all are at the center and I go out and see people in the community. So that way, if there's things that the center can help them with, I can at least explain it to people and make sure they know what's being offered and how they could go about accessing it.
Do you do fuel assistance for the younger people under 60 or do they do it? You do?
Yep. I get all the families.
So Joan, we just do it for the 60 and over then from the senior center?
Well, pretty much. I mean, we don't have another social worker in town, so I don't know. I can't be honest to say that everybody's been over 60, but I think most of them are over 60.
And I think most of my families and non-seniors, if they are reapplying, they already kind of know how to do it for themselves. And most of my inquiry has been around like how to follow up or where to go kind of thing. So I think seniors have more of the need in terms of like, they don't necessarily want to be told to do an online application and hope for the best. And like, they would like to have someone walk through it with them to do some of the paper applications. So we've seen a little bit of both on that.
Were you involved in the reassurance program at all with the police? What's the full name of that, Joan?
So that's in Southampton. I don't know about Easthampton.
Easthampton had a session too, right? For the.
Oh, are you talking about with like
the police
yeah, no, I was not, but I will say the Easthampton Police Department has a social worker that is paired with them through clinical and support options. So she is the crisis call response person and she handles a lot of their mental health calls and some of the things that come up for them or through them. She is kind of the primary person. And then if there's things that we need to collaborate on, we do it together. But she's also a licensed social worker. So we share a lot when it comes to police.
So Easthampton is a much bigger city, so they have quite a few or several outreach workers and social workers. But I think you were talking about the security, the one that the Polish National Credit Union put on at the country club, that one?
Yeah, but I think that's just the fact that police have their own sort of crisis manager, social worker, mental health person. That's
Easthampton.
in Easthampton. Yes. Yeah. Go ahead, Sylvie.
Could you, Liz, excuse me, just, give us a little example of what the outreach workers do? How do you work with them? How do they work on their own?
So the outreach workers at the senior center, they do fuel assistance, they do insurance assistance. I think they're all Shine certified. I think she's now officially called a program manager. She runs activities over there. And so specifically for the senior center, people can call or go in and make an appointment with an outreach worker for help with transportation, accessing the van service, if they need to go grocery shopping. So they do a lot of services specific to the van, insurance, financial needs. If people have questions about how to follow up on bills and things that they got in the mail that they don't necessarily understand. And then one of the outreach workers is fairly new. She just started in the last couple of weeks. So they only had one outreach worker for the last few months, and she's been absolutely slammed. So we're sort of still defining what that's going to look like to now have two of them plus me. But if there's anything where they're coming in and saying that they have a senior, but the senior has 5 other people at home and it's a multi-generational family and the family needs more work, then those sorts of cases come my way, because then I can take everybody else and they can focus on just the needs of the senior.
I see.
Oh.
You're muted, I think, Mo.
Yeah, go ahead, Jonathan, and then.
Yeah, so Liz, did you say that there's, the senior center has 2 outreach workers? Okay, and we don't have one, right, Joan? You made reference to something, but.
We do not.
Okay, and you said at the beginning that you have 2 social workers or 1 for the city out in addition to the police departments?
So I am the only social worker for the city as a whole. So my official title is community social worker and I work out of City Hall, but the police department has a social worker from CSO, the mental health team out of Florence and Northampton, who does 3 days a week in Easthampton and 2 days a week in Hadley. So she's here Monday, Wednesday, Friday. She's in Hadley Tuesday, Thursday, and her role is specific to crisis and mental health calls. And then as needed, we kind of share and triage opportunities and, trainings and things that come up that doesn't make sense for me to take it. And sometimes like she'll go out with the police and then realize it's much more of a long-term need for a family member. So then it gets turned over to me. She's the immediate making sure there's no urgent mental health need for residents. So our roles are pretty different, even though we're both technically social workers in 2 buildings right next to each other.
And one more question about what percentage, I know it probably differs from time to time, but in an average week, what would you say is the average amount of time you spend with issues related to seniors?
Right now, it's a good portion of my week. I think it really ramped up when the weather changed. It's hard to say, like when school started, it felt like all of my referrals were coming from the schools because kids were back in session and people had eyes on them. But now that it varies. But I would say a good, at least a third, if not half of my caseload is people over 55 consistently.
And then there are 2 other outreach people at the senior center.
Mm-hmm.
So.
And we do, there are times when I call the senior center and I'm working with someone and they're also working with that person. And so we make sure that if we're all working with the same people, we're not overlapping and having us do the same things. So
just for clarification, did you say the program coordinator is the outreach person? No. Okay. I wasn't
so
sure.
they have the senior center director, who's also a social worker, Cindy. They have Dawn, who her title recently changed to program manager because she was, I think just previously she was listed as their activities coordinator, but she was doing so much more than that. So they shifted the position. So we have the director, the program manager, and 2 outreach people. And then I do some groups and activities there. And then we have a part-time public health nurse here who shares an office with me. She's here 3 days a week, and she'll do a couple hours throughout the month for like education and health and wellness, like coffee talks over there. So there's a couple of us that are in and out, but they have the 4 staff, and then they have some volunteers who do the front desk and phones and that kind of stuff.
Rini, I know you wanted to say something. Yep.
Yeah, Liz, I'm just wondering, thank you, because I think that clarifies about the staffing in that senior center. So it sounds like the outreach workers, like right now, our volunteer coordinator, might be doing a lot of the van and transportation things, and then obviously van drivers. But it sounds to me like your outreach workers are also very involved in transportation needs. So you don't have anybody separately that schedules the van, right?
Nope. So if you are a senior who needs transportation, when you call the senior center, there's one of the immediate prompts is like, if you need to schedule transportation, press whatever. And so if you're a repeat consumer, I think the people who answer the phones at the front desk handle it. And if you're somebody who needs to start using the van, I've had a number of referrals for people who are transportation, and I refer them over to the senior center and they pick it up. Where it gets tricky is I have some people who have pretty significant needs and maybe aren't necessarily appropriate to use a van when it's full of other seniors and being out and about. So those are the cases that come back to me in terms of like working with Highland Valley and finding a way to get them individual transportation or someone to do some one-on-one support for them rather than using the shared van service. But if it's just a general like pharmacy, drugstore, grocery store, errands, that kind of stuff, yes, they go directly through the senior center.
Are you doing any direct billing? You're at LICSG, right?
I am not currently direct billing, but when I got hired, they did say that the goal and the reason why they wanted to have an independently licensed person was because if we get further down the road and there are independent services offered, they would like to be able to bill for them.
Okay. Just one more question. Are all the positions that you've mentioned so far, I know the one that goes with the police, that's handled separately, I know, but all the other positions that you mentioned, are they all funded through grants, through the operational budget? Because, obviously we're in the position of trying to decide, do we, start with an outreach worker or do we start with a licensed social worker? So I'm just wondering in terms of funding of the positions that you mentioned so far, do you happen to know how they're all compensated?
I don't know all of them. I can certainly find out and let you all know. The funding for this position and the reason it was implemented is through ARPA. And so that's how I came to be in this role. I don't know what the senior center's budget looks like. I know the police contract with CSO is separate. But I can find out, and I can certainly email Janet and let her know just on how it's all split up.
Yeah, I think that'd be helpful. Thanks.
Sure.
And how many hours do each work? That would be important too. Like, are they working 20 hours? Are they working, more or less than that?
The outreach workers are full-time.
Which is 32 or 40?
Probably 40.
They might both be 35, but I can double check. And I'm trying to think. Mine is full-time. I started as a 35 and recently went up to 40 because I was that busy. So, but I can find out what the breakdown of hours looks like.
Thank you.
Yeah.
Wow. Good information, Liz. You want to come back and join the board? Do you have time for that?
Do you know what the population and the senior population is in Easthampton?
I was just talking with somebody about this.
We can pull that off of the probably MCOA website.
I was just being compared.
Yeah. No, we were talking about it when we had we had like a little pizza party social thing back in the fall. And I had said, how many, I was asking, like, do we know how many seniors use the senior center? And do we know, because like some of the people who are coming to my bereavement group don't really use the center for anything else right now. But now that they're coming in, they're able to engage and see what else is going on. But I will say, if you have a social worker who is licensed, you should absolutely include the line in their description about having a student, because that is a second person who has to complete an internship anyways. And I have had several students reach out to me since starting here asking if I would take an intern because they want to do community-based social work and they need the hours anyways. So whether it's a community health worker or a social worker, there's certainly ways to maximize the benefit there.
Great.
And everybody always asks me, do you live in Easthampton? And I say, no, I live in Southampton.
Liz, what's your biggest challenge in terms of the needs of seniors? Is there anything that's, like consistently is a void, or, you have a hard time meeting their need right now?
Consistently since I started has been the home care shortage.
Yeah.
And I was familiar with it coming from the hospital, just trying to navigate home care for people. But I actually ended up going to a pretty huge meeting with all the program directors at Highland Valley and saying, like, am I missing something? Am I not understanding the process? Like, I have many, many seniors who are taking care of their spouses or their loved ones, or, families that are filling that gap because they just cannot get home care workers in place. And Highland Valley said very honestly, like, they have put out new contracts, they've implemented different funding. Like, it comes up all the time, especially people coming out of the hospital where, the hospital will put these great plans together of like home nursing and PT and OT, and that you should get X amount of help each week. But if there's no one to pick up that contract, then it just sort of sits there. And I have a number of people who have asked me, like, how do I get a PCA? And I think the other component of that no one had really considered is that a lot of PCAs and home aides were finding that they could offer their services as like a under the table private pay type of thing and make way more money, because with mass health contracts, they're only making, between $17 and $18 an hour, but there's such a demand. And if you're somebody who's working and you need someone to take care of your elderly parent and you're going to pay them $20, $25 cash to do the same thing, then obviously they're going to take that. And so I had people who really, I still do. I have a number of people who cannot afford to privately pay. I mean, nobody can. It's crazy. And the PCA and the home health aid shortage is just really difficult for people. And so Highland Valley's been great with trying to get creative and make sure that they're adding other services where they can. But a lot of my home visits for some of my ongoing cases are just checking in, making sure people are okay, because I know that they have that gap and it's really hard, really hard for people.
I know Northampton and Amherst have sort of a neighbor to neighbor program. And I think maybe some of the cities and towns in the outskirts need to, something has to happen. It's just a crisis, actually, but maybe developing programs like that, people are going to have to be innovative. I think communities are going to have to be innovative.
Does Easthampton have that? I thought Easthampton had a.
So yeah, Easthampton has Easthampton Neighbors, which they're really, there's a great group of people there who are volunteers who do home help for people, different types of home help. Like there's some who I know will go and do like odd jobs and getting the mail for people, taking the trash out, like that kind of stuff. But I have a number of individuals who just from day one, the need was really, how do I get some help at home? And the private agencies that don't contract with insurance and the private pay that people were recognizing they could get was really, it's really challenging for people. So I think, the healthcare shortage as a whole, it's everybody knows it. Like people are getting paid way above and beyond what they usually are in medical facilities. So of course that's going to show up in the community as well. So
what's really sad is that prior to the pandemic, there was a big push to keep people at home and, get care at home. But it has become almost impossible. And the nursing homes, obviously, they had a lot of COVID cases, but I think they're, I'm not sure how if it's shifting that people, won't be able to stay at home because they don't have anybody that can keep an eye on them and give them what they need, not 24/7.
Well, and I was, making calls and asking around and calling different agencies, and I would have people from those same agencies calling me saying, hi, I work for whoever, but I'm also looking for 10 to 15 hours a week, separate, cash on the side if you have anybody in need. And I have all these people in need and they can't afford to pay somebody $20, $25 an hour for private home care. And it's a huge expense that people don't have the money for. And if you qualify for home care or your insurance covers it and you can't access it, it's so frustrating for people.
Well, so many of the home health workers have a diverse in it, Black, Hispanic. And I just find that, they're getting paid nothing to do such incredibly hard work.
Right.
And I think that it's time that things change. It's just in the meantime, it's just going to be very, very difficult for everybody.
And that was the same discussion we had at Highland Valley. Like on the one hand, good for this group of people in this really demanding career who are doing the hands-on direct care work of taking care of people for saying, we know we can get more money and we know that we're worth it. And on the other side, there's just not the help for people where they need it. So.
Mm-hmm. Well, all right. Well, I so appreciate you giving us a half an hour of your time to really help educate us in this area.
Happy to stay in touch if you guys do decide that you're, hiring or need help with any of it. I will follow up on the hours and funding sources. And Janet, I can send you an email.
Yeah, that'd be great. And I'll get it out to everybody. Perfect.
Great. And what's the hourly rate? What is a fair hourly rate for an outreach worker too?
Okay. I will inquire.
Yeah, thanks so much.
You're welcome.
Thanks, Liz.
Take care.
Yeah, thanks for all you do over there.
Thank you.
You're busy. So, wow, that was a lot of good information for me. I hope everybody.
For all of us, I think.
It's just amazing how many different configurations of staffing and hours and, roles that people play. Like, is it a receptionist that answers the phone and, schedules people for the band? Like, it's just interesting. It's just, there's not a lot of consistency sometimes.
Right.
Everything develops from the ground up. So whoever shows up at your door and whoever, calls, and when you can have staff. I had a full staff, and then people are out sick. Our volunteers finish their tax work off, and then you're by yourself again. It's depends on the day.
All right. Any other comments before we move on to the agenda? Jonathan?
This is something to pick up later, but you did mention Easthampton neighbors, and I hadn't realized that. I knew that Northampton had started a group, and I didn't realize that Easthampton had as well. I really think that we should if it hasn't been done before, some people should make contact with Easthampton neighbors and see if there's some way that Southampton could be a part of it, since we're just down the road.
We already have that. We've been doing that for years. It's called the Community Caring Group. It's our volunteer coordinator has been doing that for years. We have a list of people. And there is something called Southampton Neighbors as well, but we do have that program out of the COA.
Is it utilized much? Quite a bit?
Very much.
I think it might be slightly different because I don't think the Easthampton neighbors, Northampton, Amherst neighbors are really through the Council on Aging. I think it's a separate group. So, okay, good. So director and chair's sort of like expense report here, our mini report. Let me just bring it up. Everybody get a chance to look at it. If anybody has any questions on it, I tried to put this month's in blue just so it would stick out a little bit, and then what we have left in the account. So, and I also sent, for anybody's information that wanted to take a look at it, sort of how a report we've seen in the past, probably a month or so ago, that talks about the I'm sorry, I saw a chat, so I just need to take a look at that. that talks about how the state formula grant is being spent. So you can kind of get the details behind the state formula grant as well, which I believe I sent out along with this yesterday. So anybody have any questions on this summary report? I pulled it right from Bradley's accounting report. Joan requested an up-to-date one for this week, and he was kind enough to get it out to us quickly. So yes, Jonathan.
Yeah, that's great. And I'm glad that we're doing these reports like this. I also found helpful what I think it was today, Joan sent out the budget that she prepared for the Executive Office of Elder Affairs on the state formula grant.
Actually, she didn't, Jonathan, just for clarification, that's an old form that she utilized that we don't have to send to the EOEA anymore, that she's using internally more for her own planning purposes and then sharing it with us.
Right. And what I was going to say that I think for us, it's very helpful. It helps to supplement the other report.
Yeah.
Breaking down in particular some of the things, specifically the other expenses and where they've gone and where they're projected to go for the year.
Joan, Sylvia and I met yesterday, and Joan volunteered to get that together, and she did. Excellent. It's been an annual report. Typically, last year was the first time, right, Joan, that the state didn't require it. But I think it's helpful for her planning and just for us to get a good overview, to have it just internally for her own information. Okay. Anything else on that? Did everybody get a chance to take a look at that? If you didn't, when you get a chance, I don't think I had it opened either. So we have a lot going through.
Okay. We have a lot going on. And I think I rounded out numbers. So now I can put in more specific numbers. I just did it quickly to have a kind of a ballpark figure.
Yeah. So just most of you probably know that, but maybe the people here just for the last year or two, it was a required document in order to get the funding to submit to the state. Now the state has said, that's a lot of work. That's, we're going to give you the money anyway. So now they do it up front, but it's a good planning tool for the director, I think, and good information for us. So we didn't have one last year, but we did have one previous year. So thanks, Joan, for doing that. Appreciate it. I hope you found it helpful for you too. So great. All right. So it's not really a treasurer's report per se. So I don't know that we have to do any approvals. It's just taking Bradley's accounting numbers and sharing them with you. So I don't believe that we have anything that we have to approve on that. So the director's report, I can pull that up as well. Hold on a second, please. Multitasking. I mean, just more or less, if anybody has any questions on this, we don't have to go through it. Everybody received it. Anybody have any questions or comments or anything that they want Joan to elaborate on? I'm sorry, Nancy Pulley's not doing data entry anymore. I didn't realize that. So
she just backed off. I think because she felt that the staffing was up to date. She just felt that she used to come in on Mondays and be able to use one of our computers. And then I know we have staff in on Monday, so she can't use the computer. So she was doing it from home. So I think it was her time. She had done it for 5 years, I think.
Yeah, it was nice of her to do it for all those years.
Yeah, but Sandy's, picking it up, and she's finding time to do that. So
good.
But we did do the grocery giveaway too. We gave out 40 bags of groceries. I forgot to put that in, but I think I think Kate or somebody mentioned it in their report. So it was a big giveaway, Thanksgiving, between the veterans and the sand delivery and the groceries. So there was a lot going on. And obviously our biggest thing was the input session, which I'm sure you'll go over. But I mean, November was very, very active month, having full staff and being able to, do whatever we could.
Okay. And I know we had some folks in October, but I see that we didn't have any.
Right. So we're not going to get our full billing for our memory cafe, which is unfortunate. But we will get administrative costs and half of it. Again, I don't know how to get the consistency. There was a couple coming and all we need is one couple. But unfortunately, one of them was ill, so they didn't come. So anyway, it's the nature of the beast. I don't know. So Southampton, maybe we're in the middle of, I'm not sure how to connect. We're doing some more networking. We're trying to do a brochure, or Sandy worked hard on a brochure. So hopefully we'll get who we need to come to the Memory Cafe. I think it really is a good program. It's just a matter of getting the right participants.
Okay. Anybody have questions? Go ahead.
I just want to say something in that apparently at the last meeting, I had mentioned that I would be able to get the, some report or maybe the flyer for the Memory Cafe to the
church
folks who are doing the Punch Out Parkinson.
Mm-hmm.
And I have to confess, I was not able to get that done in part because they had a change of leadership there or whatever.
Josie, I went there personally. And invited them, and they felt they couldn't come because of the equipment. They thought they had to come with their equipment. So I don't know if I have to reach out again and just say, it's unfortunate. We talked about changing the time because there's a conflict. So maybe we could do Thursday afternoon instead of Thursday morning. I will look at that.
Okay.
Before you print the brochure.
Right.
Yeah. Go to print on that. It's, we should solidify the time, right? Because in the brochure it says.
Right. I'm sorry. And then I got COVID and I was down for the count for a couple weeks. So I was really not, frankly, I wasn't very focused. During all that period.
We're glad you're better.
Yeah. Okay. Anything else on Joan's report, Kate's and Sandy's? Any comments, thoughts? Okay. If you want, maybe it's a good time, Joan, to bring up the flyer that Sandy's been working on, and then talk a minute about a couple minutes on the list that Sylvia created and how that might help attract people.
Yes, I don't know if Sylvia wants to mention it. She had how many on your list? About, I don't know, maybe 10?
Yeah.
Neurologist
and what's the word that works with old people, with adults?
Geriatric.
I did a search of neurologists, but not just any neurologists, just neurologists that work with people with memory issues, whether it's Alzheimer's or dementia. So I put together a list of not only physicians, but nurses and physician's assistants that is their specialty, rather than just neurologists that, work with people that have sleep issues or any other issues. So it's about a dozen names and addresses and affiliations. All of them are affiliated with either Cooley Dickinson, Holyoke Health Hospital, Holyoke Health Center, it's a hospital, and Bay State. They're all affiliated with one of the hospitals in the area. So, to approach them with the flyer and inform them that we have a memory cafe, and hopefully they'll tell their patients. I don't know if just sending the flyer or maybe with a letter inviting them, telling them of the dates rather than just the flyer going out. That's just a thought.
So my vision, and I don't know if it's Joan's vision, so she'd have to tell me that, is to print out a number of these and leave them in the doctor's offices. So people that come in have the opportunity to view it and see it, and not just give them a flyer to post, but maybe flyers that we can distribute.
Oh, yeah.
So, and we have marketing funds through the Memory Cafe that can be used for those kind of things. So I don't know, Joan, what your thought is on that.
Yeah, I think we want to send them out with a letter. I think that's a good idea. But then eventually they should be available in different places, maybe places that take the newsletter, but also places like doctors' offices. If they're starting, I know at one time during the pandemic, they took all the papers out of the offices, all the magazines, everything went.
Yes, I've seen them that they're out, not in all the offices, but the doctors that I've seen, they have flyers, they have information about the services they're either that they give themselves or related to what kind of services they give.
And I could send them to local COAs as well. So, I mean, just so that other seniors from other towns, I know we're trying to get Southampton, but I think if we get regional.
So, I mean, what do people think about sending or delivering a stack of them, or just, I mean, I understand introduce it with a letter, but follow up with a stack for their offices if they're allowed to have it. I mean, I guess the word eventually concerns me a little bit. So what does that mean to you, Joan? Or what do you think? What does anybody else think? Jim?
I have this continuing concern that we're marketing a product that we don't have. And in looking at the literature, which very carefully they speak about having trained facilitators and trained participants. And do we really have anybody on staff other than possibly Joan, who's really trained and qualified to provide a memory cafe that's worth people attending? And I don't know the answer to that. I'm not accusing anybody of anything, but my reading of that document that we have sort of suggests that there is a level of expertise that is really essential to formulate a workable program. And might we not be better off with maybe coordinating with larger COAs? And like, for example, and I've given this no thought other than, for example, the Easthampton COA has social workers, which we don't have. Would it be beneficial to try to co-sponsor a memory cafe with them?
So I think that's a great idea. This grant was, they accepted this grant and it goes until September of next year. I mean, I can reach out to Easthampton. They do want to see collaboration. So I could reach out to Easthampton and see if we could, we did try to collaborate with Westhampton, which did not come to fruition. But like you said, they have social workers and outreach workers. So, I mean, I think that's not a bad idea. I don't want to just give up on it because I know it's a good program. It's just the marketing of it.
Right. And even the fact that I think we only have 46 people in town over 85 years of age, according to the census. So, I mean, that diminishes the size of our market. So maybe even by casting a broader net, we'd be able to attract more people, and the program would therefore be more, if I noticed you use the word interesting, more involved, more active, and I'm just asking. I have no idea what's the correct answer.
So I don't think Alzheimer's is dedicated to the 85 and over population.
No,
so
I realize.
I don't think we should make an assumption based on just that very targeted population. There's many of us in our age bracket that probably.
I didn't mean to imply that it was related to 85 and older. I've lost a couple friends to it way before they were 85.
Yeah. Okay.
Yeah. But it was just an idea of talking about market size.
So your thought, Joan, would be to ask Easthampton to host it instead of us hosting it?
No, I would still like to host it. I just wanted them to invite their folks to our place.
So how do you address Jim's concern about quality person to lead the group?
So
that was a question, I think, that
each program we have usually a speaker or a topic and other information available. I mean, if their social worker was available to come, and I don't know what their background is either. If, maybe MCOA has somebody on their staff as well, or the dementia friendly group, I think out of Northampton. I know there's somebody on the Highland Valley board who's very connected to the dementia friendly. So, I mean, if you feel that in the center, there should be somebody that has more information or more education about dementia than myself, or, we can invite other people to be part of the program for that day. I think that's fine. I can think of about 3 people I could reach out to see if we could get them to come to the center. It's all timing though. I mean, if they're available. Yeah,
no, I don't mean to solicit solutions or anything at the drop of a hat here at the meeting, but I was just thinking of maybe it's something that we should give some thought to for future discussion and consideration.
Well, we're in the middle of a grant, so it's not like I really was tempted to drop the program, and Janet was very insistent that we need to continue it and trying to make the best of it. And I think we've done some really good programs. We've had some good attendance, but it's hot and cold. It's mercurial. What's the word? Mercurial?
Mercurial?
Yeah, mercurial. He used it the other day. So some days some months we really are on target. We have, 18 to 20 people with the appropriate participants. And other months they're not, there, but we do have good programs. So I'm willing to look at the next 3 to 5 months, see if we can get some other people involved that might have more experience or education than I have in that area. I'd be glad to do that. But we're good until September, so.
I think it's important for everybody to know that the people that you come in as the talent are people that are dementia friendly, that have that in, that's part of their, right. They're somewhat trained in that area. And they do this at not just our center, but other places as well. Yeah. So it's not.
It has to do with music and, music and seniors that it's a proven fact that part of your brain, the music part of your brain retains, even though you may have dementia, Alzheimer's, you may not remember a person's name, but you remember a song or lyrics to a song. I mean, there's a big connection with music therapy and that pet therapy. And there's different therapies that we're trying to introduce at the art therapy, all those things that, use other parts of the brain.
And those people have been involved in training for working with people with dementia and memory loss. Is that correct? And I just said, I don't want to, the word insistent, I guess I didn't want to give up yet because I felt we hadn't done everything. But if you, again, we're just advisory board, if you feel that you want to scratch the program, I think that's your call. That's not my call. So
I think we're in for the long haul now.
Okay.
So I have a question. At the end of September, what are the options? Is it very likely that it could be, let's say we have a very successful program, Highland Valley agrees, is it likely to be renewed?
So that renewal has to be done, I believe, in May. So
There'll be a reapplication, right?
a
You have to
reapplication has to be done in May, and maybe we'll just go on a different tangent. Maybe it won't be a memory cafe. Maybe we'll try for the outreach worker again. I don't know, but I think that's due in May.
Susan, I know you had your hand up too. So.
Well, it seems like this is a process, and I love the brochure. I thought it was really appealing. The marketing brochure. I thought it was really great. I love the pictures. I love the color, the graphics. So I hope that gets out there because I think it's really useful. But it does seem like since we've already kicked this can down the road. That hopefully in September it's possible. Community is so important, right? When we're dealing with memory issues, just being with other people and working on music or what have you is really useful. And then hopefully there could be this next step in September that maybe we could get a professional involved. If we have some success between now and then. So I think just being able to form community with companions, people that need and want help in this area is the first step.
I have a feeling it'll be in January, February, March. I'm going to try to introduce some of these other professionals. So it would be before the next round of grants.
Okay.
So I think Rini, who had to switch to her phone. All right, you want to speak, Rini, and see if I can hear you? Yeah, you're not muted, but I don't think you're connected. You're not connected by audio, Rini. So I don't know if you want to try to dial back in, because when I look at your phone number, it doesn't show me audio's enacted. So. Yes, Jonathan.
Yeah, I don't think there's anything to add. I would just emphasize that I think the issue that Jim raises is a very important one. And there are no easy answers, but it is an issue that was first raised when we got the grant. A couple of us, Rini was one of them, talked, about the importance of having some type of expertise in dealing with people with dementia and in a professional way, not just being able to relate to them. And so I think the issue is out there. There's places to go to talk about this. I mean, the Highland Valley is a resource. There's and I didn't read it carefully, so I don't know how helpful it is, but the memory toolkit, that Memory Cafe toolkit that Janet, I think, sent around to the board a couple months ago.
From MCOA. Mm-hmm.
Yeah, so there's stuff out there, and I know that you've talked, Joan, to other centers that have hosted memory cafes. But I just want to emphasize that I do think it's an important issue that Jim raises with probably no easy answer for us at this point. And then I think an outreach coordinator in the future would be very important for dealing with some of these issues.
If we have a social worker and outreach, it depends. So, Rini, let me just share Rini's comment. So she texted me, wanted to stay, and she just wanted to say that it's good to get a speaker from gerontology, dementia care, maybe from Cooley Dickinson. Is that Rini? I think you're not muted, but you're
making a turn.
You hear your car moving.
You're driving very well. Good show.
Yes.
Or not.
That's crazy. Can you hear me now?
Now we can hear you. Yes. Okay.
John's driving. I'm not driving.
Okay.
But there's a fairly new dementia, home visiting program. I think I mentioned in the past. And I was part of a group called the Dementia Initiative a long time ago. And this woman ran support groups for family and patients with dementia. And one week she'd have entertainment, the next week she'd have an educational program on status prevention or managing skin problems or urinary tract infections. But they have nurses, and I think, Janet, you and I both know a couple of the nurses that have been involved with this program. anyway, I just think it might be nice and interesting to see whether or not attendance increases when there's a topic that might be of interest.
I know, Rini, that Laura stepped down from that program at this point, so she's not involved anymore. So I don't know who else is involved, but I know we gave some.
Yeah, Karen Romanowski, a friend of mine is, and I'm happy to contact her. So, Joan, if you want me to, if you want to follow up and think about getting a speaker from that particular program, it would be great to have the gerontologist, actually. I don't know if she'd be willing to do that. But anyway, let me know. I'm happy to help.
That'd be great. Thank you.
Okay. Thanks, Joan. I just wanted to also mention, let me just get the next thing on the agenda is the walk mass. Let me just see if I can.
Oh, I called MCOA today, and the check is not in the mail, but it should be soon. They'll be delivering it soon.
So we talked about this back in April about the walk mass and registering people's, steps and miles and whatever they do. And Southampton got a second place prize of $500. So congratulations for those people that input their steps and walks and miles, and we'll take $500 any day, right, Joan? So it was second prize. Right. So congratulations.
Thank you.
Okay. Memory Cafe marketing. So I know we just give you a lot of information, Joan, and I know you filter through it and figure out what you want to do with the marketing brochure. And but there's a lot of good time and energy that put into that. I know your comments to me were always that you felt you were trained and capable of helping to manage the program. So I'll defer to you on that. So planning for the state formula grant, you shared that. So that's taken care of. We're moving right along. So the ARPA subcommittee that's been discussing the $50,000. So we had three kind of top things that came up at their last meeting. One was looking into an outreach person. The second one was looking at maybe some way of fundraising and hiring for the future senior center and hiring an organization using the ARPA funds to help us do a capital campaign. And the third thing right now that number three was the cultural trip. So Sylvia, do you want to do a quick kind of a brief update on the fundraising organizations and any information you uncovered? And unmute yourself because we're all guilty of that. Now I don't feel so bad.
I'm here. Yes, I contacted the director of the care center, who's the one that passed me the information. I have two contacts and other information, and I started doing the research last night, putting together a list. And then I'm gonna, once I have my list together, call her again, and just for her to give me more detailed information in each one of the organizations that I put on the list. And then I can bring it in and figure it out how we moving from there. One of the thoughts is, I know two of the people that she gave me, calling them on my own and just saying, hello, how much you charge? And so we can have an idea if it is a set amount of money or a percentage of how much we want to fundraise, so that we can target how much money we need from the ARPA grant. Because right now at this point, we don't even know, I don't have an idea how much to ask because I don't know how much they charge.
Okay, and this was to ask for additional ARPA funds for this, not to take it necessarily from the $50,000.
No, that's totally separate.
Yeah. So, and the other thing is there's two of these groups in town, two committees, the public safety and the senior center committees that are going to be looking for ways to,
work together.
Ways to fundraise, and how do we work together? Do we work together? So there's a lot of question marks because we're kind of, we're both going to be going to to the pot, for.
True. Also,
So-
at yesterday's Friends meeting, there was a gentleman that lives in Southampton. He's a friend of Mike O'Neill, but he's been working, Bob McKeon, I think is his name. He's been working for an organization for Stanley Park in Westfield, fundraising money in order to fix it up and do more things around it, and programming. So that's also him can bring in some ideas once we have a go to it. But for now, at least, we're beginning to talk about that, how to work together. It was sort of like the beginning of conversation, like you said, to work together with the other folks that need to do fundraising for the other building that is needed in town, rather than doing, one group doing something and the other one doing something that we need. We all need the money. Try to work together, but that's in the future. But at least we're beginning to talk about that.
And Cindy Palmer from the Public Safety was at the Friends meeting yesterday and kind of weighed in as well. So,
yeah.
Okay. And the cultural trips, Jim and Joan, I know you both had some input into this. I know Jim was unable to make that meeting.
But he sent a letter that we use most of it in our January newsletter. And so it just discusses that the ARPA funds will be used to underwrite the costs of transporting seniors to various educational and cultural entertainment venues. And the objectives would be to build a sense of community and friendship, encourage membership and participation in the COA, and to highlight many diverse activities and programs in our area. So, as you know, there's a lot of museums, Smith College, and they have not only the art, but they also have botanical gardens and greenhouses. And he put down about a dozen places that might be of interest. Of course, the transportation costs, if we use the Frida van in the state of Massachusetts, it's one thing. But if we have some bigger things where we go, more than 10 or 12 people, then we'd have to get costs of transportation as well. But, the thought was to underwrite tickets to a theater or to a show and to have a cultural trip from the senior center and use the ARPA funds to pay for it. You're muted, Jim.
You're muted, Jim. Sorry.
Yeah. But yes, I was
just to underwrite it. For example, we might use the funds to pay for a rental vehicle and ask people to pay, their contribution would be for their meals or possibly admission even, but it'd be more affordable.
Very good. So I should use that word affordable. Yeah, the discussion was to stay away from food and meals, but there might be cases where we're someplace where it's during a meal time, so that that would be paid for by the person versus the grant.
Yeah.
And I guess my only concern, Joan, before we move too far down the road, is to actually put a budget together on how much of the 50,000 would go for this, how much of the 50,000 would go to the outreach, how much of the 50,000 would go to computer classes, if that's something that we want to talk about as well. So the 50,000, especially if we hire an outreach worker, we've got to, I think before we promote or launch or do too much, we still have some details, and you need to work out a budget, and how much of that would you dedicate to this versus the outreach worker. So for example,
I can work on that in the next month.
Okay. Yeah, before we go too much live in the newsletter, I think I haven't seen the article, so I don't know if it's just coming to a theater near you or, what it is. So just to kind of.
Yeah, we don't have any specifics, but.
Okay. Yeah. Jonathan?
A couple of questions. First of all, the three things that came up on top, those were listed in order or not necessarily in order of priority?
In priority.
So the outreach coordinator being first.
Correct.
Okay. And so I've got a question. say we do hire an outreach person or a fundraiser with ARPA funds, and let's say it's somewhere between $20,000 and $50,000, okay? Or maybe a combination, the two. What happens after that 50,000 is spent on all sources, and we want to continue something such as the employment of the outreach person or the fundraiser?
I mean, and that's a good question. I was very surprised when Liz said that her position was also being paid out of ARPA. So, that's those towns that find a need and find a person and fill that need, have time to work through those, I think, logistics. But I don't know what they promised her, after that. I don't know. It's grant funded, and maybe it gets us through the first couple of years and we show the value, and we can then justify it to the town from that point on. So those are things we would have to work out, but it's advertised as a grant funded as Liz was as well.
Janet, can I say something?
Sure.
Yeah, I wasn't aware. I mean, I was on this group too, and I wasn't aware that we identified the fundraiser position as being sort of second ahead of cultural trips. Is that what everybody else's understanding was?
No, Rini, that's if we're going to apply for additional funding from a separate source, not the $50,000.
Okay. All right. I just want to be clear about that.
Yeah,
and Jonathan, right now we have the whole neurodiversity program at Norris is being funded by ARPA with the hope that we would save on out-of-district placements and be able to fund the position after the 2 years. And then the conservation agent is actually 100% funded right now for 2 years by ARPA money. So the hope would be that any position that we use for ARPA money would be able to be absorbed into the regular budget or the state formula grant or something. But it would be, usually for 2 years.
So the thought is that for an outreach person, for example, that person would be hired for 2 years with ARPA funds.
We could do whatever, or Joan could do whatever she, wanted to, do if, it could be less number of hours and less money than the whole thing. I mean, I think that's something that has to be decided, but I think that the subgroup felt that this would be one of the best ways of spending the money to meet the needs of the senior community.
And that's why Liz's information, I think, for salary and so on, will be helpful and important. And I don't know, Rini, so if we go over 19 hours, then it's a benefited position. So, I mean, there's all sorts of things we kind of have to think through and discuss and, determine if we can attract somebody. I mean, it's so we're a little ways, but we do have to kind of, before we spread out much further, determine how much of that $50,000 are we going to need for an outreach person, because that was pretty much the top priority from recommended by the group, but has to be adopted by Joan. It's her decision. It's not we recommend, and Joan was, I think, comfortable with the outreach would help her.
Right. We're not limited. We're not limited to 2 years like we are for the town ARPA money, right? There's no time limit on the $50,000.
Right. We have the $50,000.
Yeah, that's good.
Yeah. Jim?
I may not have heard clearly because I have hearing problems, but with regard to the fundraising, did you say that was not anticipated to be funded by ARPA?
Not this ARPA. So there's other ARPA funds that are through the town. So this ARPA 50,000 came specifically directly to the Council on Aging.
Right.
Each Council on Aging received funding through ARPA. But the town has a bucket of money from ARPA that we can apply for fundraising to be supported through that. But we need more information. We need to figure out, is this what's the public safety doing? I think my point was that I wouldn't start fundraising until the town's made a final decision on what they're going to do with regard to a new center, because if you raise money for a specific project and don't use it for that project, it would be Trumpian.
And
Yeah, I mean, we're
It would be later after we get
Yeah.
the 2.5 million.
okay, that
Yeah,
was my
we're
only.
not going to start tomorrow, but we have to start now looking into the possibility of being able to get the money.
Sure.
and
No,
moving
I just
the
wanted to
higher-
clarify that.
No,
Yeah.
we're not going to do it tomorrow.
Good.
and we're not taking it from the 50,000 that we received
No.
because it's
Good.
okay. Does that make sense, everybody? Okay, is John enjoying the meeting, Rini?
He's commenting on Jim's comments. We've enjoyed his comments. Actually, I'm on headphones, so he can't hear it. He can only hear me.
Okay. So let me so we'll move on as far as to the next item is the feasibility committee. So thank you to everybody that came to the in-person input session. I think we had a great turnout. We demonstrated that we maxed out probably parking as well as what our senior center can handle. I believe I sent the results out to everybody, the feedback from Abacus, the summary sheet. But what we're working on as a follow-up to that is a Survey Monkey, because I think every member of the ad hoc feasibility senior center committee received emails from people, I can't make it, but blah, blah, blah. And so we want to get as much input as we can. So Abacus is working on, and we've approved questions for a Survey Monkey that we can get out to the community to get additional feedback, more than just the 70 people that attended the input session. So that's kind of our next thing. And we're also at this point working on trying to get some soil test samples for the properties that we're looking at to make sure before we go down too far down the road that they're buildable properties that we can utilize. So that's another hurdle that we need to jump over before we narrow down our list of potential sites for the senior center. And they did share with us kind of an initial layout of what their vision based on the input from the input session might look at. So they're kind of tweak that, and we're going to meet next week on the 15th again and talk a little bit more about those plans. So any questions from the group? Or any comments from Joan and Rainey, the other feasibility members? No.
I think it's going along really well.
And then Rini brought up at the last meeting that the Public Safety Committee also would like to have a joint meeting sometime in the first quarter of next year. They are looking at probably not getting their study completed until late 2023. Is that correct, Rini?
Yes, correct.
Okay.
One comment that I would like to make, and I think Janet brought it up yesterday, was that when somebody says, why do we need a new senior center? We need to have an answer. The one we have is inadequate. The one we have, it doesn't serve the seniors of Southampton as many as we need to serve. So, I think that question is out there, and I know the taxpayers are very concerned about tax rates going up, but this discussion of fundraising and where the money's going to come from will happen hopefully after we get our 2.5 million. And so to ease people's minds that it's not going to be laying on the backs of the taxpayers, that we're going to do our darndest to, get endowments or get foundation money or get grant money or wherever we can find money to put in the pot to build the center. I know it's very expensive, but it's so important for a town to have a place where seniors feel comfortable and have, adequate room for activities and privacy and services.
Yeah, and it's, Jim, it's kind of a catch-22 when you were saying we can't do the fundraising until the town's approved the money, but we can't go to the town to have the money approved unless we know how much we can fundraise. So it's like, it's trying to get our ducks in line, so which comes first, and we'll work through that, because we don't want to go to the town for the full amount if we're going to try to fundraise. We'd rather, but you don't want to fundraise and then not get the rest of the money from the town. So if you have any solutions, let me know. So Josie.
Question?
Josie.
I thought I may have misheard. I thought you said that the group that's doing the feasibility for us,
Then yes,
is they don't expect to have that done until the end of 2023.
No, that's the Public Safety Committee. Their feasibility study was pushed out until the end of 2023. Ours is still targeting a March completion for the study.
Oh, good. Okay.
And with the deadline of May. So thank you for clarifying. I wouldn't want somebody to walk away with that impression. No, we would be in deep tapioca if that was the case, right? So we're definitely going to make our time frame of May.
Good.
So to have the money approved for us. So, okay. Anything else on that topic? So the next thing on the agenda as we move along here is Jonathan had sent us a document, and I wanted to give him an opportunity at least to kind of walk through it. His vision of a roadmap, and because we keep having it on the agenda and it keeps getting pushed off. So Jonathan, I'm going to ask you to kind of walk us through this if you don't mind, and tell me when, and maybe explain your thoughts behind it.
Well, I'd initially written Janet at the end of September, hoping to get on the agenda for the October meeting or some, future meeting that was imminent, a discussion of just of finances in general. And Janet said that would be good because she was been thinking about doing that and doing it in conjunction with a planning for programs and funding in future years. Janet initially had talked about doing it for every 5 years up to 2040. I think she's since reframed that as a 10-year plan, which I think makes a lot of sense. So this is really meant to be pretty simple, and it's not meant. It may seem to be oversimplified, but the idea is, and I've said this before, and I know there's some debate on this, but I really think that discussions on what we do in the future are much more productive and more efficient if at the very beginning we have an idea of cost. It doesn't mean you know the exact cost, but that issue comes up quickly enough. And it did earlier today when we were talking about an outreach coordinator, for example, or doing the cultural trips, that we need to kind of have an idea of what we're talking about, and then we can see what's doable. It's possible that some things just drop out, even though it might be a priority early on. Doesn't necessarily mean that. So I'm really a great believer in as soon as possible getting to the money. So you just don't end up with a list of 30 things on your wish list and go from there. And finances are not easy to come by, and as Rini has pointed out, it's kind of ephemeral, and you hope that there will be sources to continue certain programs, but certain things don't seem to be even dependable right now that we're talking about on a year-to-year basis. But we may not have any other way to talk about it. All I suggest is just be aware of the money and be aware of some of these other issues. As I think, and I think we've made progress in getting an idea of what we have now and what we're spending on it. And I think that's where you have to start, with the ongoing programs that are meant to be ongoing, and the salaries and wages of existing staff positions, and try to get an idea by category of what those are. And then you go further into the expansion of those programs and increase in hours of existing staff positions. I think it's clear in what Janet distributed earlier, a couple of meetings ago, from the feasibility committee, that was an outline that was submitted to Abacus, to the design consultants. And it indicated what we were thinking of for new positions in the future, how many hours. And so this is really talking, and on that, some of the existing positions were talked about increasing the hours. Also, as we all know, a lot of positions every year, there's often salary increases, might be changes in benefit levels. So that has to be looked at too. Again, none of this is, you can't be too scientific about this. The information is not always going to be there, but you have to go ahead and take a look at it and come up with some estimates to have an idea of what you're working with and where the shortfall might be and what you have to do to where to go, what the sources are for additional funding. So again, starting with the ongoing programs and salaries, and then looking at expansion of those programs and or increase in the hours of existing staff positions. And we're talking about doing all of that. That's come up today. It's in several of the discussions that we've already had today. Can we go on to the next page? And then you're talking about completely new programs and staff altogether. So not just expanding what we now have, not just, and some of that's actually the position, the priorities that we talked about earlier with the ARPA funds, those would be new programs and possibly new staff. And some of the staff that's listed in the outline that the feasibility committee had prepared some of those are completely new positions. So next is going beyond that. Where do you find the money? And there's all kinds of things. So there's funds originating with the town. That's the current annual property tax. There's the issuance of bonds, which I think at some point people have to have an idea of, every time the town has to issue new bonds, how much will at whatever the current rate might be for bonds, how much will the average homeowner's property tax increase? It's just something to be aware of when having those discussions and getting an idea of what might be feasible. State grants, obviously the state grant that we get every year from the executive office for elder affairs, and then there's those that are. And those are ongoing. Then there's those that are discretionary and might be one time only. For example, the ARPA grant. You've got the grants from nonprofits such as Highland Valley Elder Services, such as the one that we now have for the Memory Cafe. Again, when you have something like that, is it one time only? For how long? Easily renewable. And if something is not, and you want to continue the program, it's like we need to have some idea where the money might come from. There's donations and they can be from obviously money that is contributed that's raised and contributed by the Friends. It's also from corporations, individuals, corporations, individuals, and estates. The best example of the estate is the approximately $2.5 million that's been left by Red Parsons to build a new senior center. And I would just say on that is something that now that that's been done and a good example has been set, it's something to look at for the future, how we want to encourage additional for people providing in their wills for any money to go to the town, whether specifically to the COA or otherwise. It's again, if we have a fundraiser, we might also need to talk to that person, although I don't think of all fundraisers or experts in what I'm going to suggest, but in what a lot of organizations, a lot of nonprofits call planned giving to advise people. Now, just one thing I want to say is that on a lot of this, on the donations and stuff, and it's certainly like if it comes from an estate, that's not money that is going to be seen tomorrow or necessarily 5 years from now. We were lucky, in Red Parsons' case, apparently no spouse, no children, no grandchildren, and he drew up the will a year before he died. So that money became available almost immediately. But again, it's something to think about for the future, long term. It doesn't necessarily solve some issues for the next few years. Endowment, again, and this overlaps with the donations. An endowment can be created, and is it for the town, or is it for specific purposes such as for the COA? Usually with an endowment, as I understand them, the principal is invested with income used for expenditures and improvements. So that would help with some ongoing programs to make sure that they continue to be funded way into the future. There's collaboration with other entities, with other councils on aging, with other town departments. Sometimes there's money to be saved. We talked about the possibility. This is a very, very small example, but when with custodial or redoing the floors, waxing them, cleaning them in the senior center, whether that could be rather than the senior center absorbing the cost, could that be done by the town? And save some money or a portion, prorate the amount of money that would come from the Council on Aging's budget. That's a very, very small example. And then there might be other sources. Who do you talk to? Where can you get help? I've listed some possibilities. I think we never should be shy about asking and talking to others. Now, what I'm suggesting is not something that's necessarily going to happen that easily. And it takes work, and there has to be people willing to do it, and kind of a consensus as to just how we want to approach these things. But I just wanted to set some of this out. I really do think that the money is always an important issue. I don't think anyone disagrees with that. But I think as keeps coming up in our conversations recently, no matter who brings up something or what the topic is, we get back to the money issue. And I think it shows one very positive thing, which is that we really are thinking about the future and what we want for our town, what we want to do for seniors. And I just hope that there's some way in which we can help with that process, and see if there's a way that we can do a lot of the things that we're talking about doing and do it, and make it a reality. That's my presentation.
Thanks, Jonathan. I know you put a lot of thought into doing this, and I'm glad we got a chance to have a conversation about it. Thoughts from anybody in the group? I know Renee dropped off. She had to leave. And Josie's heading off too. Okay. We won't be on much longer, but.
I think that was an important outline. I think, it's a scary proposition to build a multi-million-dollar building and to staff a multi-million-dollar building and to furnish a multi-million-dollar building and to the utilities and everything that goes with it. It's just, and it doesn't happen unless it's funded, obviously. I know that Southampton has an extraordinary volunteer population. If you look at our commissions, if you look at our COA, if you look at anywhere in town, a lot of Southampton's things are done by volunteers. So yes, there are staff that are in charge but I see the future that if they're able to find the funding to complete a senior center, that yes, there'll be people in charge. There'll be people that have to clean it and staff it, but it'll also be for the town people that don't work there, that the seniors that will be able to use it. I don't know. I have a big vision. I've seen it happen in other towns. I know it can happen. But the money, obviously you can't just say that, money will just come from trees, because it doesn't. So it's a lot of hard work. It's a lot of leadership. It's a lot of, planning. And I like that, what you had planned giving. I like that phrase. I've never heard that, but I think that's, if you have these philanthropists and, like Mr. Parsons, I mean, I think it's going to be a combination of things to make this happen. And it's going to take years. It's not going to happen overnight, but I believe it's going to happen for Southampton.
And there will be, and I'm not sure how much is included, but part of the study will be a cost estimation. So we'll get kind of a vision. And I don't know, like I said, that it's going to be all inclusive, but that's why they kind of ask for staffing and ask for that kind of information that we'll see hopefully towards the end of the study to get kind of a big picture view of what that number could possibly be. So, but thanks, Jonathan. Anybody else, any thoughts, comments?
I just wanted to say that this was really meant to be exclusive of the new senior center, at least of the actual initial construction and getting it furnished at the beginning. Because that's really something that the feasibility committee and I reckon will be struggling with the town administrator and the senior center to come up with solutions. But we will have to figure out a lot about, making things continue to work, the things that Joan has mentioned, the new staff that might be added in order to make the senior center really work, and just the additional maintenance. That's not going to be obviously as expensive as a new senior center, but they add up, and they will be cost year after year, and they will not be reduced unless you make cuts. So that's, again, it's something to think about, if our dream of a new senior center comes to fruition.
I will tell you a story about Hamden Senior Center. So Hamden Senior Center was built for $1 million, I don't know, maybe 20 years ago. If you visited that center, it's a lovely center, big parking lot, a lot of amenities, kitchen, big dining room. They only funded it for a year and it was closed. I don't know if they had plans to make it a restaurant or what they were going to do. They closed it for a year. And then the town found the money to keep it going. But that was 20 years ago. So I don't know their whole story. I just know that it does happen that yet if you don't think about the funding, then it doesn't happen. There needs to be planning.
Yeah. Good. Great. Okay. Thanks again, Jonathan. I'm going to move to, I know Rini had to leave and she just said, don't forget the special town meeting Tuesday at 9:00 at Norris School. That was her.
7:00.
7:00. Did I say 9:00?
Yes, you did.
Hopefully it's over by 9:00. 7:00 at Norris School. 7:00 at Norris School on the 13th. So we have real quick discussion on board member recruitment. Jonathan, I'll let you start.
Yeah. So I just want to I met with Janet yesterday. I asked to meet with her because I wanted to let her know that I'd done some thinking and just needed to make some changes in how I wanted to do things in my life going forward. And I'm at that point where I'm ready for a break in this type of volunteer work. And I've been doing, not for the town, but a number of different, venues for a good while in retirement, as I think all of you have too. I'm just at that point where I'm ready to take a break, and I've been on this committee, this board. It will be 2 years in March. The first few months as a alternate, and then I became a full board member. So I'd mentioned to Janet that I would be leaving sometime in the next couple of months. I would like to stay on and just kind of help in the transition as far as making sure that we recruit members, that the board has enough people to do its business. So anyways, it's no reflection of what I think of people on the board. I couldn't have been happier with my colleagues here. You've all been great to work with, a number of different views. Everyone has a lot of experience, and I've learned from people. about that. And I've learned a lot about how the town does a lot of business, and what both the things that make it stand out, the type of things that Jones mentioned about volunteers, for example, but also various limits to that the town is forced to work with the town funding and stuff, and being a small town. So it's all been very helpful, and trying to get an idea, getting a new perspective on just how things work, and how one gets things done for the town that you believe in. And I think everyone on this board obviously is very, very committed to seniors, and I'll continue to be there. And if you open up a new senior center within the next couple of years, I'll be talking to Sandy about what I can do in the senior center to help out with some programs. So
I said to Jonathan, he always makes me think differently, because, he always comes up with some thoughtful, I'm like, oh, that's a good idea. That's a good thought. Hadn't thought of that. So we will miss that input. I will, as we move forward to do more recruitment, we need to try to encourage people to stay the term that they sign up for. It's very hard. Nancy stepped down. She was a few months into her 3-year term. It's hard enough at the end of the terms to fill those slots. So, Jonathan, you can't leave until your replacement is in place. So start working on that now. No, but that's always something that's important, I think, to share with people that are looking to sign up. So, next year is my probably my 7th year, because I think I started in the middle of somebody's term, and our bylaws clearly state that, after 2 full terms, we have to step down for a year. So after next year, I will be stepping down as well as a non-member of the board for at least a year. So, we've got to work together as much as we can to encourage anybody that's interested in serving on the board to reach out to me, and I would be happy to tell them what a great board we have here. But Jonathan, thank you. Thank you for giving me the heads up yesterday. I do appreciate it. And as I said, we'll see you on the pickleball courts next in the spring, if not
for sure.
Okay. Yeah. He's going to run the pickleball next year. I didn't mention that to you, Jonathan. Okay.
I may not run it, but I'm going to help.
Thank you, Jim.
My term expires in May, and I will not.
The end of June.
Okay, the end of June.
Yes,
and I will not continue beyond that either. So
okay.
So we all have to do a good job talking up, getting onto the board. So I don't know, at the town meeting, I don't know if that's appropriate, but if you see any friends, neighbors, people who have grandparents that you might use the center, if you can think of anybody at all and think outside the box, local businesses that they may have, an hour or 2 a month to be on a board. Don't be shy about mentioning it and trying to recruit, because it's so important to keep the flow going.
And I know that if the pickleball players see an email from me saying we have a couple openings on the COA board, anybody interested, you may see that email go out, because I know there's some good, thoughtful people that might be interested. You never know, right? Who's going to be interested in doing that. But thank you for your time. We have to make our personal decisions to do what's best for each of us. So. And
yes,
Jimmy kind of gave me a heads up to that before. I think that you said you had shared that with me before, that you probably wouldn't go for another term. So I appreciate you letting us know in advance, because that also helps. So Jonathan, will you be here January and February meetings, do you think?
I'll be here January. I plan to step down February 1, but as I indicated to you yesterday, I'm fine to stay on to the end of, through the February meeting and on to the beginning of March.
So I cannot be the clerk. So we have to think about that as well. So. Yeah.
So let me just ask Janet, you said just for the minutes here that your term limits, your term is up at this summer or the next summer?
2024.
Okay.
Yeah. Yep. So we'll be some recruiting. So Jonathan and Jim, start planning your replacement. Okay. I'm still waiting for Nancy's.
I
So.
nominate John. Jonathan.
I nominate Jim for my place.
Okay.
And if he can't take it, maybe Nancy.
All right. Thank you. Thank you for sharing. You want to give us your friends update?
Yeah, not much here. The friends met yesterday, and as I've planned all along, I don't try to repeat anything that's in Joan's report or stuff that's really irrelevant. So the treasuries remained about the same, between $13,000 and $14,000. The next meeting will be on January 10th, a regular monthly meeting, and then they'll after that morning, they'll go into the annual meeting at which they'll elect new officers, as happens every January. And so this year,
10:30 is the regular meeting and 11 o'clock is the election.
Yeah. So the regular meeting will be short. The annual meeting is at 11. And I think anyone who is a Friends member is welcome to attend that. I think actually any friend is welcome to come to the regular meeting, monthly meetings as well. So it's something to keep in mind if you're interested in the future. Open. So at the positions that they'll vote on at the annual meeting will be the chair, vice chair, and a director at large. One of the questions that came up, they're talking about, well, what meaningful responsibilities can we give to the vice chair? And one thing that was mentioned as a possibility was to have that individual be the Friends representative to the COA board, just kind of paralleling what I have done, it being the liaison to the Friends. So I passed that on.
Maybe we can get them to be a board member and then they can do.
Well, that's always a possibility, maybe. There's the major expenditure recently was for they subsidized the grab and go bags, grocery bags that were distributed to those who needed them for financial reasons at Thanksgiving, and that was nearly $1,000 that came from the Friends to subsidize that. The Sylvia, and as she indicated, Bob McCowan, but mainly Sylvia, gave a report on fundraising, similar to what she talked about today, and trying to let the Friends know what's being thought of, and that this would hopefully supplement, on a different level what the Friends now do. And I think that is all.
Okay, great. Thanks, Jonathan. All right. Anything else before we say have a happy holiday season? Enjoy whatever you are doing. And we will see you on January. Let's see how close it is to the first of the year, right?
It's like the 4th or something.
January 4th. So we should be good with that, right? Is everybody good with that? Okay.
We may have to have our planning meeting on Tuesday again, but there's no Friends meeting that day, so that works.
Yeah, it gives you a little more free time.
Mm-hmm.
All right, great. Do we have a motion? Any parting comments before we go? And again, thank you, Jonathan, for your service. Greatly appreciated, and your insights that you've brought to the committee. So, do we have a motion to adjourn?
I move.
Jonathan, second.
I'll second.
Susan, all in favor. Sylvia.
Aye.
Susan.
Aye.
Jonathan.
Aye.
Janet, aye. Okay, we had a quorum. Good, we could close the meeting. All right, great. Have a happy holiday, everybody.
Thank you, everybody.
Thank you, everybody.
See you at the special town meeting. Bye.
Okay.
Yes, see you next week.
Bye.
All right.
This government meeting is brought to you by Eastworks and our local cable subscribers.